This patient presents a heavy face. We notice that she's round and short, giving us the heaviness over the nasolabial folds. Zoom in. When we look closely, we see that the position of the cheek has lowered. We see the tear trough, we see nasolabial folds, and we also see marionette lines. When I bring a little bit lower, we notice that to improve the nasolabial folds, I need to inject L1, L2, and L3, and I also need to inject L8. So she needs more than the 3 previous lifting codes. Xiao. When she smiles, I also notice the presence of deep nasolabial fold, Xiao, with the presence of widening of the nasal flare. Now, let's proceed to marking. Let's zoom in, please. When we go to the marking, we have to ask the patient to look up. When the patient looks up, we notice the difference in color between the lower eyelid and the cheek. So, let's study code by code. When I put my finger, I can draw all the region that is represented by L1. So, this is L1. Now, the position represented by L2 is a much larger area, and this is area L2. L3 is the mid-cheek area, and this is the area of concern. So we have here L3. Now, let's study a new area named L8. L8 is an area that comprises the lateral aspect of the cheek and is also important to improve the lowest part of the nasolabial folds. So here is L8. So these 4 codes, 4 MD codes, they are very important to release the heaviness over the nasolabial folds. Now, let's study NL1, and NL2. And NL3. So, 3 areas to support the upper part and mid part of the nasolabial fold, and one last part to give support to the lower part. So let's mark L1 and L2 and L3. Now let's proceed the injections. After cleaning, retract and position a posterior L1, and I'm injecting 0.2 in L1, 0.2 in L2, and 0.1 in L3. 0.2 in L3 as well. So after injecting L1, L2, L3, please observe the change not only in the nasolabial folds when the patient puts chin down, but also in the heaviness of the cheeks. Now, when I observe the patient, look up. When I observe the patient, no, straight please. When I observe the patient, I see that the nasolabial fold is almost gone when I compare to the other side. Because of when she looks down, her nasolabial fold is still heavy in the lower part. Now it's time for us to inject L8. Because L8 is a bigger area, I need to give lateral support to the nasolabial fold, and I needed to use Ultra Plus with a cannula. So cleaning is very important. Then I pinch to penetrate the entry point needle. I make a round movement. Then I ask my assistant to remove the needle so that I can easily progress with the cannula. Gentle movements are done so that the patient do not feel any pain. Gentle movements may help us to deliver lifting to the nasolabial folds without any discomfort to our patients. Observe how gentle and slow that I inject in L8. If you inject slowly, the patient will not suffer at all. So I am almost finishing with a full syringe of Juvederm Ultra Plus gauze. After 1 ml, we simply take out, no bleeding. Now remove the marks and let us see the effect that L8 presents on the face. Take a look, the dual effect of Juvederm Ultra Plus lifts and also improves, chin up, the nasolabial folds. So when I make a traction in the cheek, the nasolabial fold becomes less evident. Let's sit up the patient. Look at the camera. Zoom out. Take a look how beautiful her face looks, and please observe that now, after L1, L2, L3, and L8, the heaviness over the nasolabial fold has decreased. This is the patient, camera, at rest, smile, and this is the beautiful patient on animation. Take a look, smile. Take a look how the nasolabial fold was almost everything gone. Chin down, eyes up, eyes up. So now marking the same area, feeling L1, L2, L3, then marking L8 to decrease the heaviness of the nasolabial folds. Now let's proceed with Juvederm Ultra Plus. Getting and injecting in L1, deep, and aspirating, injecting 0.2, aspiration 0.2, and finally aspiration 0.2. Now let's proceed with L8, cleaning, entering the point, circle movement, and injecting with a 25 gauge cannula. Very slowly, so that the patient does not suffer any discomfort. Ton bouton? So this has to be injected into the subcutaneous, and this gives us a lateral support for the inferior part of the nasolabial folds. Now let's remove the marks. Close your eyes. Now injecting Ultra Plus to improve and also reduce the excursion of the nasal flare. Injecting NL1. (0.1), NL2, 0.2, NL3, 0.1. Let's check the direct approach. We can notice also the change in the position of the nasal flare. Now with NL1 there is more support. Smile. And in smiling, take a look what happens to the nasal flare. Yes. Now let's proceed to direct approach with Ultra. Now injecting directly in ultra. And then NO3. So 0, 1 in each point. Now, in her case, I injected L1, L2, L3, and L8 to change the heaviness over the nasolabial folds. And then, directly, I injected two of them ultra. Ultra plus in the supporting points, the lifting MD codes, and ultra directly into NL1, 2, and 3. What I would like to mention to you is this. Please observe the natural result immediately after. Smile. So immediately after, she presents natural smiles and no at all stigma or presence that she was injected. So this is the new technology, giving a treatment, making the patient look younger and with no presence of treatment. She can go immediately to her social and professional activities.